What if everything you've been told about heart disease is missing one critical piece? Millions focus on cholesterol and fat, but the real culprit silently damages arteries from the inside out, long before a heart attack strikes. This overlooked condition is the true trigger of heart disease, and today, you'll discover how to fix it. Welcome to Levitas. How does it increase the risk of heart disease? Most people think of insulin as the hormone that controls blood sugar, but it does far more than that. It plays a direct role in heart health. Insulin resistance occurs when the body's cells no longer respond properly to insulin, forcing the pancreas to produce more of it. Over time, this leads to chronically high insulin levels, setting off a dangerous chain reaction inside the cardiovascular system. High insulin levels damage the endothelial lining of blood vessels, making arteries stiffer and more inflamed. This leads to a condition called endothelial dysfunction, which is the first step toward plaque buildup, high blood pressure, and heart attacks. Insulin resistance also increases inflammation, which accelerates the formation of arterial plaques that can block blood flow. Additionally, it promotes the production of small, dense LDL particles, the most dangerous form of cholesterol that penetrates artery walls and fuels heart disease. Despite these serious risks, most people with insulin resistance don't even know they have it. But here's where things get even more surprising: insulin resistance doesn't just affect blood sugar. It also plays a major role in cholesterol levels. Does insulin resistance cause high cholesterol? You've probably heard that cholesterol is the enemy of heart health, but did you know insulin resistance is a hidden driver of dangerous cholesterol imbalances? When insulin resistance develops, the liver becomes dysregulated, leading to an overproduction of VLDL or very low-density lipoprotein, a type of cholesterol that eventually turns into small, dense LDL particles. These tiny LDL particles are far more dangerous than regular LDL because they easily slip into artery walls, triggering inflammation and plaque buildup. At the same time, insulin resistance lowers HDL or high-density lipoprotein, often called the good cholesterol. HDL helps clear excess cholesterol from the blood, but when its levels drop, harmful cholesterol stays in circulation longer, increasing cardiovascular risks. Even worse, insulin resistance leads to oxidized LDL, which is even more likely to damage blood vessels. This oxidation process transforms LDL into a highly inflammatory substance that fuels plaque growth and arterial blockages. But cholesterol is only part of the equation. Another dangerous blood fat, triglycerides, skyrockets in those with insulin resistance, further increasing heart disease risk. Why do insulin-resistant individuals have higher triglyceride levels? Triglycerides are a type of fat found in your blood. After eating, your body converts excess calories into triglycerides and stores them in fat cells for later energy use. However, when insulin resistance sets in, triglyceride levels rise to dangerously high levels. Here's why: when cells stop responding to insulin, the body can't process sugar properly. Instead of burning glucose efficiently for energy, excess carbs and sugars are turned into triglycerides by the liver. This leads to a flood of fat into the bloodstream, increasing the risk of heart disease. High triglyceride levels contribute to a condition called atherosclerosis, where fatty deposits accumulate in the arteries, restricting blood flow. Elevated triglycerides are also linked to increased clotting, which raises the risk of heart attacks and strokes. Even more concerning, people with high triglycerides often have low HDL cholesterol, meaning their body struggles to remove excess fats from circulation. This dangerous combination, high triglycerides, low HDL, and small, dense LDL, is a telltale sign of insulin resistance-driven heart disease. But the damage doesn't stop there. Insulin resistance is also one of the biggest hidden causes of high blood pressure. How insulin resistance leads to high blood pressure. Insulin resistance is a major cause of high blood pressure, yet most doctors don't talk about it. When insulin levels stay chronically elevated, the body retains more sodium and water, leading to fluid retention and increased blood volume. This forces the heart to work harder, raising blood pressure over time. Additionally, insulin resistance stiffens arteries. Healthy blood vessels are flexible, allowing for smooth blood flow, but when insulin resistance is present, The arteries become less elastic and more inflamed, causing a persistent rise in blood pressure. Another critical factor is the effect on nitric oxide. Nitric oxide is a natural vasodilator, meaning it helps relax and widen blood vessels. However, insulin resistance impairs nitric oxide production, making arteries constrict and blood pressure rise. This dangerous combination, fluid retention, arterial stiffness, and reduced nitric oxide, significantly increases the risk of hypertension, heart attacks, and strokes. The good news is that reversing insulin resistance can dramatically lower blood pressure and restore arterial health. But how do you do that? Watch right next. How can you protect your heart if you have insulin resistance? Protecting your heart starts with fixing insulin resistance at its core. The most effective strategies include cutting out refined carbs and sugar, since excess sugar fuels insulin resistance and triggers fat storage. Reducing intake can quickly lower insulin levels. Prioritizing healthy fats and proteins is key. Focus on omega-3s, grass-fed meats, avocados, and nuts to stabilize blood sugar and fight inflammation. Regular strength training and exercise play a big role, since building muscle increases insulin sensitivity, making cells respond better to insulin. Magnesium and potassium-rich foods, because these minerals help lower blood pressure and improve arterial function. Intermittent fasting works by giving your body a break from food, allows insulin levels to drop, promoting fat burning and heart health. But what is one thing you should be cautious about? Statins, they're not the magic solution for heart protection. But why are statins not the answer for heart protection? Statins are often prescribed to lower cholesterol, but they don't address insulin resistance, the true root cause of heart disease. While statins reduce LDL cholesterol, they can also increase insulin resistance, making metabolic health worse. Research shows that statins can raise blood sugar levels, increasing diabetes risk, lower coenzyme Q10, a critical nutrient for heart and muscle function, and fail to prevent heart attacks in people with insulin resistance because they don't fix inflammation or oxidative stress. Instead of relying on statins, improving insulin sensitivity through diet, exercise, and lifestyle changes provides real protection for the heart. And the best part is, once you reverse insulin resistance, your heart health can improve rapidly. But how quickly can heart health improve after fixing insulin resistance? The moment you lower insulin levels, your heart starts healing. Many people see improvements within weeks, and in some cases, even days. Blood pressure drops within 1 to 2 weeks of cutting out sugar and processed carbs. As insulin levels normalize, arteries relax, fluid retention decreases, and circulation improves. Within a month, triglyceride levels plummet as the body stops converting excess sugar into fat. At the same time, HDL cholesterol rises, improving heart protection. Plaque formation slows down because inflammation decreases. Over time, some studies suggest arterial plaques can even shrink when insulin resistance is reversed. Within 3 to 6 months, individuals who consistently follow an insulin-friendly diet and exercise plan often experience normalized blood sugar, lower blood pressure, reduced belly fat, and improved energy levels, all crucial for long-term heart health. By addressing insulin resistance at its root, you can take control of your heart health naturally, without relying on medications that only mask the symptoms. In conclusion, insulin resistance is a silent but powerful driver of heart disease, triggering high blood pressure, dangerous cholesterol imbalances, and excess triglycerides. It stiffens arteries, fuels inflammation, and promotes plaque buildup, significantly increasing cardiovascular risk. Yet, most treatments focus on lowering cholesterol rather than fixing the root cause. Addressing insulin resistance through diet, exercise, and lifestyle changes can rapidly improve heart health, lowering blood pressure, reducing arterial damage, and restoring metabolic balance. Unlike statins, which only mask symptoms, targeting insulin resistance offers real, lasting protection. The key to a strong, healthy heart isn't just managing cholesterol, it's fixing insulin resistance at its source. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated, it helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.